Ladies and gentlemen, dear colleagues, I will talk about osseointegration of the upper limb amputees, a prosthetic treatment and outcome. Amputation levels treated are transhumeral, transradial and thumb level, and also we have one partial hand. Prosthetic procedure and rehabilitation after stage 2. Also at the upper extremity level, the more specific part of the rehabilitation starts after the second operation. Between the first and the second operation, there are 4 months for thumb level and 6 months for transradial and transhumeral level. This shows weight training with the short prosthesis. 3 to 6 weeks application of weights and axial loading, and it's increased over time. And then range of motion and strengthening exercises of shoulder, back, chest, and upper arm muscles. And here we see range of motion with and without prostheses. And final prosthetic application depends on skeleton quality and indication of pain in stump muscles and bone. And at transhumeral level, we see the abutment, the PAC system, and the attachment device. And to don and doff the prosthesis is a quick procedure. And the patient can be provided with either cosmetic, body-powered, or hybrid, or myoelectric, with both myoelectric hand and elbow. A transradial amputation, they can have a cosmetic, body-powered, or myoelectric prosthesis. And we have to wait for 3 months after the second operation. At some level, a cosmetic prosthesis. And here we see activities of daily living, some examples. For instance, kitchen activities, dressings, such as tying shoelaces, and gardening with myoelectric prosthesis. And with a cosmetic thumb, using the computer, playing cards, and pouring milk. This is a clinical follow-up we did in February 2009 of the upper limb prosthetic uses with osseointegration. And the material are all uses with bone-anchored prostheses who had their prosthesis more than 1 year. Included were 25 persons, and there were totally 34 prosthetic applications. 9 were excluded, 4 were non-users at the time. 1 could not be reached by post or by telephone, and we had 4 users less than 1 year. Amputation level on these 25 patients were 11 transhumeral, 9 transradial, and 5 at thumb level. The age range was 24 to 77 years, and there were mostly men. And here we see the results for prosthetic use. And to the left-hand side, we see daily use. And before osseointegration, there were 32% who used their conventional prosthesis 8 hours a day and more. And after osseointegration, there were 72%. And on the right-hand side, you see non-use, and there were 7 patients who were non-users before osseointegration, and 5 of these were thumb amputees. And here we see prosthetic sensation, range of motion, and don and doff. So patients state that after osseointegration, their prosthetic sensation and also range of motion with prosthesis were improved in 84% and the rest unchanged. At transhumeral and transradial level, to Dodd and Doff were improved in 95% and unchanged in 5%. And here, thumbs were not included as they did not have a prosthesis before osseointegration. And on the next one, we see function and quality of life. And 92% state that overall function were increased, and 88% say they have improved quality of life. Patient's own comment on function. At transhumeral level, the prosthesis feels like a part of myself. The prosthesis feels more secure, it doesn't come off. I have improved range of motion, I have better precision, I can carry more weight. On activity and participation level, according to ICF, I can do more in the kitchen. I can jog, I can dance, I can do yoga, and I can work as a referee. And at transradial level, I experience more comfort. No sore stump, I can sense where I have the prosthesis. And also, I can put on my trousers and shoes. I can hold knife and fork, drive a horse, and ride a motorbike. And on thumb level, I can live a normal life. I have improved quality of life. And also, at thumb level, I can handle money, I can do handicrafts, I can write, I can work in a shop, I can build a stone fence, and I can ride a horse. So patients indicate more freedom due to increased range of motion, improved function in daily life, and increased comfort compared with their previous experience with the conventional prosthesis. So, osseointegration is an important platform for introducing new prosthetic technology, as we see examples from here, due to the stable fixation. Thank you.